Hello, everyone. Thanks for listening. My name's Hannah Boyd. I'm the head practitioner and naturopath at New Leaf Naturopathic Health. And I'm having a bunch of conversations that I'm recording with some of my favorite health professionals, people that I send my patients to, and people that I just want to celebrate, and also people that I really like and like to have a chat to. And one of them is Amber Rule, who runs a few different counselling services, but one in particular called Rough Patch. And a lot of my patients do utilize Rough Patch, and I just thought, let's have a chat because what you do is really great, and I love people to know more about it. Hello, Amber.
Hannah, thanks for having me.
Tell us a little bit about Rough Patch, where it came from, what you do, and how it all works.
hmm So, Rough Patch is a affordable counselling service, and as far as we know, we're the first of our kind in Australia, in so-called Australia. And we were very generously given this idea by a wonderful Canadian social worker whose name is Kate Scowen, and she founded Hard Feelings Mental Health in Toronto about 6 years ago, I think. And the idea was that in Canada, their healthcare system is kind of analogous to ours, although it is a little different. So, what I understand is they get something of a block of funding, a bit like our NDIS, and then they use that to access their mental health care. And so, from what I understood, the fees for seeing, say, a mental health practitioner, either their classifications are a little different than ours, but either a social worker or a psychologist used up almost all of that kind of allocated funds. So, you might be able to see a therapist once or twice with the amount of money that the government allocated. So, Kate's idea was basically, can we create a service where people in the middle, so the ones who can afford to pay a little bit but can't afford to pay the full fees or would need to see someone for more than, one or two sessions, because let's face it, there's so many things that you cannot sort out in one or two sessions with a psychologist or a therapist. Her idea was, can we create a service that offers some good mental health support to the community, but also values the therapists who work in that community? Because, as lots of mental health practitioners and, physical health practitioners know, the types of organizations that we work in and the jobs that we do are stressful. And we're not always able to, because of resourcing or funding or any other number of things, we're not always able to do our jobs the way that we want, and we're not always able to offer the things that we want to be able to offer to our clients because of the resourcing or the lack of resourcing. So Kate's idea was, can we bring together people who are passionate about providing affordable healthcare to the community and support them really well in ways that they wouldn't ordinarily be supported in organizations. And if we can do that, then we support them to reduce their fees on a sliding scale. So it kind of is a bit of a quid pro quo for everybody involved. Clients get cheaper service, still high quality. The counselors get a really supportive management-ish, esque style. And I say esque because obviously they're not employed by the organization. And then a really supportive community of practice with other practitioners who feel similarly. So that was kind of the genesis of Rough Patch, and Kate was very generous in supporting me and still does with our version here called Rough Patch. And we started out so I'd sort of been in planning for about 2 years.
Yeah, wow.
Uh, yeah, yeah.
A
It's a
long
big,
time.
long time. Yeah, that's right. And really just like trying to decide whether this would work in the Australian market. Um, my fantasy had always been and I wasn't, until I came across the hard feelings model, I wasn't sure what that would look like, but I knew from my time working in services myself, um, how difficult it was and how expensive it was. And I just wasn't sure how I was going to do it. So when I came across the hard feelings model, I thought about it for a long time. I did a lot of budgeting and all that kind of stuff. Um, so we started in sort of August of 2020, just coming out of the first COVID lockdown. So yeah, I had been really lucky that I managed to survive that period as a private practitioner in solo practice.
Yeah, and you had
Um,
bricks and mortar at the time as well, right? So it was a tricky time like me. I mean, we were all sitting there
yeah,
thinking, what is going to happen to our practices?
exactly.
It was a very stressful time for patients and for us as
Yeah,
clinic owners and business owners as well. Really
that's
stressful.
right. I don't think, your average person who has never worked in small business actually really understands not just day to day in normal pre-COVID times, how hard and stressful that is, but to for all of us to have survived that period, solo practitioners or practitioners in small group practices, that was just, for months we were really just barely getting through it all.
I know it was very, I remember thinking a number of things. One is, I've worked so hard for so long, and
Yeah.
is it all just going to fall over? And two, I may as well just help as many people as I can at the moment because they all need help. So I just thought I'll just throw myself into the care of my patients and not
Yeah.
worry about anything else. When I
Yeah.
look at my stats for that year, like how many patients I actually help, I thought, oh my God, that is way too much. It's fast track to burnout. No wonder I was exhausted after 2020. But yeah, it was a very stressful time for small business. And yeah, good. I've always, when I explain your service to my patients, I always say, yeah, you set up during COVID and you did such an amazing job to get that done. So yeah, very hats off to you. You did a good job there.
Mm. Thank you. I mean, it was one of those things where I really had no choice at that point,
Yeah,
right? I'd already committed, I'd already put money into it, I'd been in the planning phase for ages. It was just like, well, this is happening. We'd
yeah,
signed a lease, all that kind of stuff. It was like, well, this is happening. So if it all falls apart, then well, I guess we deal with that later. And I say that flippantly, but at the time it was really scary,
yeah,
but we understood that. I mean, I say we, it was really me and some key sort of volunteer or pro bono support people. So, our lawyer, our accountant, some friends of mine who have various expertises. Um, but, we were kind of talking it through at the time, and it was like, well, there is absolutely a demand for affordable mental health care in Australia. And we started out in the inner west. So we had a single clinic with two counselling rooms and a small mental health shop. And I'll tell you more about how the mental health shop works with it all in a minute. But we were kind of like, well, there's it's really obvious that there needs to be more mental health care provision at the time in the inner west, and more broadly, Australia needs more mental health care that's affordable and accessible. And so we figured it would work, but we knew, like any new business, especially one that's a not for profit, that we would always struggle and that we would need time to kind of see if it was going to work. So my kind of, I guess, idea was that it was a 5-year project. We could see if it would have legs in the Australian market. And then I suppose my biggest fantasy is that after 5 years, which is coming up soon, actually, I
yeah.
think we're about 6 months away. Or not even, no, we're like 3 months away. Um, my biggest fantasy is that I would be able to put together um, the data from the first 5 years of the project and go to government and say, look what we've done. It can be done. All you need to do is seed fund a organization like ours, and then it will be fully self-sufficient. We'll never have to ask you for money ever again.
Yeah. And
So
people get help, and I think mental health crisis is access to mental health care in Australia is very problematic and unaffordable for so many
that's right.
people.
Yeah.
And particularly during that time, the government did, raise the, Medicare, plan so people get access to more healthcare, but still,
Mm,
it's still not enough. And I think the expectation is when people do get referred to see a therapist for, 11 or 12 sessions, the idea is,
mm.
oh, well, I'll get it all done in 11 or 12 sessions and that'll be it.
Yeah,
And sometimes that's right, but a lot of time, as you said, it takes a lot longer to work through plans, and having a model that's sustainable for the patient as well as the practitioner is really, really important.
that's right.
Yeah,
And I think,
great service.
thank you. I think so many people don't understand the difference between, I mean, we use the word therapist as a bit of a catch-all, but really, there's no title, certainly in Australia, that's therapist. So therapist is a bit of a catch-all for people who do talk therapy, right? But in Australia, there's psychologists, there's social workers who register and become, and social workers can train in a variety of ways and then end up doing a variety of things. One of those things is counselling, and then there's counsellors, clinical counsellors, and psychotherapists. And neither counsellor or psychotherapist is a protected title in Australia, the way that psychologist and social worker is. So anybody can represent themselves to be a counsellor with no training whatsoever. Like you could just put the word counsellor on your business card tomorrow, and that's okay. Whereas with psychologists and social worker, that's not the case. So there's a real confusion amongst consumers and mental health practitioners, in fact, about what's what and who does what. And so unfortunately, what that means in Australia is that psychologists tend to have these really, really long wait lists because they're the ones who can offer the Medicare rebate. Counsellors are unable to do that. And so there is this huge pool of talented, skilled counsellors who are not receiving referrals, especially from GPs and psychiatrists, because A, they can't offer the Medicare rebate, and B, because our industry is not regulated. And so people understandably don't, are concerned about referring to a practitioner from an unregulated industry. Now, the unfortunate part about that is, like any industry, there's great therapists and there's terrible ones, just like there's great psychologists and terrible ones. So just because you passed the exam and got your registration doesn't make you necessarily a great practitioner. And so that's part of the difficulty. There is also a mental health hierarchy where psychologists are seen as more skilled, more educated, more effective than counselors, which is simply not true. It just isn't. So, but consumers, when you're just feeling big feelings and you're having big stuff going on in your life, consumers don't have the time or the energy to navigate all of that, right? They just want help.
Yeah.
And that's a really unfortunate part. So a big part of the Rough Patch project has been like slowly educating consumers and other healthcare professionals that counseling is hugely helpful. It is usually less expensive than psychology services, even with the Medicare rebates, because most folks will only, well, a lot of folks will only be able to afford to see a psychologist if it's the rebated session, which has now gone back to 10 sessions only. So you go to your GP, you get a mental health care plan for 6 sessions. The psychologist then writes back to the GP and says, I think you should approve this person for a further 4. The client is approved for another 4, and then that's all they can have in that year. A counsellor, you can see them for as long as you want, as long as you can afford it.
Yeah.
So obviously there are people who should be seeing psychologists, and that's a really important distinction as well, that counsellors can't do all of the things that psychologists can. And particularly clinical psychologists who've got specialist training, and obviously psychiatrists are different again. They're doctors who deal with medication and those types of things. So obviously there are things that counsellors can't do, but I think generally speaking, a lot of folks don't understand that there is a lot that we can do, and that we do have registration bodies, and any counsellor worth their salt will be registered with a registration body. And so there is accountability processes and complaints processes, and counsellors get deregistered when they behave unethically. All that kind of stuff is in place. So
it's really fascinating, and because the similarities, I think, with naturopathy and regulation is very, very similar. Like I think,
right.
A lot of our governing bodies do look for counsellors as a very good model of how you have managed to professionally organise to ensure public safety and knowledge is at its absolute best. Like naturopathy also is an unregulated health profession, and anybody can call themselves a naturopath, which is really quite frightening, and they continue to. And just with any health profession, just because you're a naturopath and you may have done the training doesn't also mean that you are going to are good at what you do.
Yeah.
But the training that practitioners come out now is a 4-year bachelor degree to become a naturopath, and people don't actually realize the amount of work that goes into doing it, the amount of science and study that you need to do to be able to work with people's biochemistry. And so I think in terms of public safety and knowing who a naturopath is, like commonly see naturopaths who don't put their association membership on their website, don't say where they were qualified, like what skills they have, because, and that just shocks me so much, because the public, if you're wanting to help the public, not letting them know who you actually are in terms of your qualifications, like how is the
Mm,
public going to know the difference between, shammy health coaches and highly qualified naturopaths or counselors? It sounds
mm,
very, very similar. And I think,
mm,
the work that a big part of my profession does is moving towards a regulated health profession. And there's been sliding doors moments for that to happen and not happen number of times in the last 15 years. It's
mm.
looking more and more likely that that will happen in the near future, which is fabulous because it protects the public from bad health care, I think, more
Yes.
than anything. I'm really, it's really nice to speak to other health professions who are in the same place, because it makes you feel like, okay, we're out here sort of trying to do the right thing by our patients, and we're not the only ones that are doing it.
Mm.
So yeah.
Yeah. Yeah, it's really unfortunate too, because I know some counselors and psychotherapists who just have done incredible work in their careers and have been doing it for a really long time. And um, frankly, could run circles around some registered doctors or psychologists or whatever, So I think, from a consumer perspective, my encouragement is always, if you have the energy and the spoons and all of that, to do a little bit of research about, um, the differences in training of those practitioners. And again, any good counselor or any good talk therapist, in fact, should be able to answer your questions in non-defensive ways and not, offer you, say, a quick phone call or a couple of questions via email, to reassure you about their skills, training, capacity, and all of that kind of stuff. And I guess a red flag would be if someone becomes defensive or refuses to have any, information sharing before a first session that you have to pay for in full, all those kinds of things. So yeah, a big part of the Rough Patch project has been not only delivering the frontline kind of service, but also helping people understand the differences between counselling and other modalities, and especially for us, doing that through a lens that actually critiques dominant mental health discourse. So we call ourselves, anti-oppressive informed practitioners, and we think it's really important for us to acknowledge, in an industry full of well-meaning white women, um, that there are barriers to becoming a therapist, for example. Excuse me. And one of those is, if you have the means and the support and the opportunities. And unfortunately, what that means is our industry is flooded with a certain type of person, like I said, a well meaning white woman. And I think this is the case for a lot of care
Yeah,
industries,
naturopathy the same. I mean, one of the things that we always talk about is like, how can we create an accessible model of healthcare? Because what naturopaths do so well is not just selling people a bottle of supplements and saying, go and take this vitamin C, but doing holistic naturopathic philosophy, which is at its very best lifestyle medicine. So understanding the world in which the person lives and who they are in the world, and making sure the world is supportive and reflective of them, and making sure that their health is optimum. I mean, the research that comes out these days is exactly shows that, keeping people well and keeping people out of the medical system with preventative health, naturopaths can do a huge heavy lifting in that space and keep the public of Australia very, very well. And I think if people knew that that's what naturopathy at its very best is, rather than it being privileged health
Mm,
for middle-aged women, it actually is a whole philosophical model of care that
mm,
actually can permeate into everybody's being of a life. And I think
yeah.
there's a lot of really fascinating research in that. I was just speaking with a trans researcher this morning, looking at overcoming barriers to access to healthcare for trans people, specifically into naturopathy, which I think was just such an
Mm,
interesting conversation. So yeah, like I think overcoming those barriers to care. In your experience, what are the main groups that you feel really do miss out on that access to care when you're looking at that accessible model? Is there anything that you would say in terms of making sure that they can, who those groups are and how you can access and support them the best that you can.
Yeah, so it's the same for clients as it is for practitioners, really, and that is all of the usual folks who are marginalized in our society and culture. So that's people of color, um, in the States, that's Black folks. In Australia, that's Aboriginal and Torres Strait Islander folks. Um, Queer folks, especially, we know trans folks are one of the most marginalized and most discriminated against in the health kind of arena. Young people, people with not as much money and means and generational wealth, people who are cut off from their parents and supports. So all of the usual folks who are marginalized and unable to access a lot of things in our culture are the same people who are unable to access affordable and when we say accessible, we mean things like how quickly can you get in to see a practitioner? How easy is it to get there? What barriers are there for people to get there? So for disabled folks, for example, is it easy enough to get into the building? How much does it cost you in both time and energy and money to make it somewhere? All those types of things. And so when you start to think about it through that lens, it makes sense that, there are a lot of people who can access stuff, usually white folks with means, and who can get to services in order to get those supports, whether it's mental health or otherwise. And we really wanted to, and I will acknowledge, first of all, I am a well-meaning white lady who was, that privileged by some of these, accessibilities that I have. And don't get me wrong, I also have marginalizations, but, largely was able to access all the things that I needed to survive and continue to have those privileges. But really, so first of all, that we have those privileges. Secondly, that I've lost my thread, Hannah. Sorry, what was the question?
Access to healthcare for
Yeah,
marginalized groups, and what are some of the strategies that you would do to support them in that
yeah.
work?
So I suppose that's what was happening. I was acknowledging that while we try really hard to make sure that we make our service as accessible and affordable for people as possible, and accessible meaning lots of different things for different people. Um, the nature of our organization is that we don't receive any government funding, and we never have. We are fully self-funded. So I put up the seed money, basically my life savings, which was pretty meager. And then this organization continues on the backs of the therapists who offer reduced, like quite significantly reduced service. And so we do our best to kind of be, like I said, an anti-oppressive, have an anti-oppressive approach, and an inclusive and, I guess, thoughtful, considered approach, but acknowledge that we've still always got learning to do. And there will always be things that we simply can't provide because we're not resourced well enough to do that. And so we do what we can with what we've got, which is quite, it's not very much. And that's where the community of practice really comes into its own. That, what we effectively do is provide a space for private practitioners who are self-employed to do that with something of a safety net, and, to have access to other people who are doing it at the same time as them, and have access to a full community of people who have got their own expertises and life experiences and stuff like that. But yeah, it's really hard work, and we don't always, we're not always able to deliver as much as we wish we could. And certainly, we've made mistakes along the way because, as I said, there is really, apart from hard feelings in Canada, there is no kind of rule book or way of doing this. So it's been a hard slog, and I sometimes wonder if, what it would be like in a sort of alternate universe if we had a bunch of money and we could do this stuff really well.
I mean, apart
uh,
from, fantasy money, what would it take for you to feel like, what do you need? Like if you were to write a wish list of like, okay, this would make life easier for Rough Patch and make it more, its reach bigger and its success even better. I mean, I would say that you do a fabulous job. It doesn't look like, I mean, you don't make it look like hard work from the outside, if that
Mm.
is anything to go on. It looks very well organized, and my patients who access your care find it easy to navigate and very useful to use. So, good feedback there. That's
Gosh.
good. You're doing a good job. But like, so, fantasy world, what would, if the sky was the limit, what would Rough Patch be?
Mm.
Would you ask the government for funding, or would you, how would you roll it out en masse, so to speak?
Mm. First
I'm
thing
a
is,
thinking big kind of person, and
yeah,
I
yeah. For
practice
us,
manager hates it on Monday morning when we have our clinic meeting. It's like, I've had an idea, and she's like, oh, another
oh
one. Here we
no.
go. Hannah's had another idea. I mean, she loves it and hates it because, like, I think when you do want to help people, you have to keep thinking about
Yeah,
ways to make it work for them and also for
yeah,
you. I think that's really important because as you mentioned earlier, like this work that we do one-on-one with patients or in small group stuff, that as well as I do, like it's hard, taxing work even if you
yeah.
love it,
And
and
I think this goes
you
back
have to
to
keep
the
making it
um
work for you. So,
anti-oppressive,
dream big. What's the
anti-racist, anti-ableist
fantasy
piece
rough patch
is
picture look like for you?
so many people, for a variety of reasons, whether you as a practitioner understand it or not, prior to telehealth becoming so widely accessible, were missing out. And the reason that you may not have known that as a practitioner is because you never came into contact with those clients, right?
Mm-hmm.
So I think, again, there are so many valid critiques of psychotherapy and counseling and psychology at large. And one of them is that it's kind of out of touch with the way the world actually works. And so these folks can sometimes exist in kind of echo chambers where they're like, well, the best way to do therapy is XYZ. Well, I'm sorry, the best way to do therapy is actually be able to get to therapy,
Yep.
however you can get there.
Yeah.
And I think that conversation prior to COVID was so contentious and heated. And now they've all just kind of, which makes me so happy, they've all just kind of had to eat their words. And
Yeah.
don't get me wrong, it's an adjustment in many ways. Like you said, it requires a different skill set and different support systems and all that kind of stuff. But, I was seeing people on Skype before. Remember
What's
Skype? I
is
was
that?
seeing people rural, because my specialty is addiction support services. And so I was seeing people, in rural Australia because they couldn't get service where they were. So that was something that I offered. But, it wasn't nearly as popular, obviously, as it is now. But now, if someone's a bit sick, they can stay home and do their Zoom. Or if someone's got to be at a meeting 5 minutes
That's classic
afterwards,
inner
they
west.
can
Show me
do it at
somewhere in the
work
inner
in the
west that
meeting
isn't
room.
leaky
Like,
and moldy, and
and don't get me wrong, I
that's
think there
they're
are
all the same.
some
So it was classic. Perfect. Yeah.
people with certain experiences in which in person is still really important. So people who've experienced severe trauma, people who are doing certain types of therapies like EMDR or something like that, can be, vitally important for them to be working in person with someone to feel that the frame is safe enough.
Mm.
Um, but largely, I think that a lot of the pushback about Zoom counseling came from therapists, not from patients.
I think the
And then,
telehealth model is so fascinating because we were just talking with some friends over the weekend. When you think back to the, life-changing, world-changing shifts that happened through the pandemic, and the idea that suddenly we can work from home or we can work online, and the fact that getting together with your team is it makes you feel awkward in real life, whereas on person you used to makes you feel more comfortable. Not for me, I'm fine with either, but I think the transition to telehealth has its barriers and its successes as well for patients, because it is, personally, I find it very helpful for my patients to be able to access my care. And I think back to the time when, people would come out, they'd have to take a day off work to come and have an appointment, or half a day off work. And
yeah,
now they actually don't need to do that, which is really
yeah.
important. Have you found, since you've made that transition, that you've been able to access other people? Like you feel like that's been working, better for your practitioners to sort of be able to help more people?
Thank you. Yeah. Thank you, Hannah, and thank you for your support. If anyone wants to learn more, they can go to roughpatchcounselling.com, and we're on socials as at roughpatchcounselling. We're also currently recruiting for new counsellors. So if you are a mental health practitioner and interested in joining our community of practice, have a look at our website. And of
Of
course, if
course,
you've
there's
got any
always old white
questions for
guys at the
Judith
beginning
and
of this
Message,
story.
either on socials or via email address, we're always happy to respond. Sometimes it can take us a minute because we're mostly volunteers in Rough Patch headquarters, but we will definitely get back to people if you've got questions.
Personal care, absolutely. And to upskill, there's insurances, there's
Exactly.
systems. I mean, one of the things as a virtual clinic is to have really good systems that means that
Exactly.
everybody can communicate and work well behind the scenes so it's seamless for the patient. And
Exactly.
really, we put a lot of effort into doing that. I mean all my practices are based all over Australia, and my practice manager now lives in Japan. So it's like,
Wow.
we're really everywhere in the world, which is amazing. But our patients don't realize that because we have systems which, sure, there's no rent that we're paying, and, you don't have to
Mm,
pay the cleaner to come in or buy your own toilet paper for the clinic bathroom anymore. But
mm,
there's things that do, overheads for a business, whether you're online or
or
not.
not.
And I think that the challenge is, definitely, I mean, the same thing with, I think, a lot of those therapies, people having to sort of pivot really quickly to go, oh my God, how do I do a telehealth consult? And the thing that, our profession is trying to instill into education for future naturopaths is not minimum level of education on telehealth in the clinics, in the student clinics, but like really integrating how to do very good level of telehealth care, because it is really important that it's one of those skills that you might actually just need to learn how to use,
Yeah.
not as a, oh my God, the world's going back into lockdown and I need to keep working and need to help people. It's like, this is how a lot of people should be accessing their healthcare, and to do it well is not easy. There are certain trainings and ways that you need to do it, not just the
Mm,
systems and the privacy and all those kinds of things. So I think encouraging practitioners to upskill in telehealth. Those old guards, tell them to go and old white men to do some training in it. It'd probably help their practice a little bit. So
I
everyone's saying,
know.
yeah. No, I mean, if patients, if you offer something to patients that makes sense to them and fits in with their lives, then they will say, yes, please, thank you,
Yes, please. Yeah.
percent. And I mean, I see people with chronic health conditions and their
Mm,
lives, the number of spoons they have is very limited, and they need to support them. You have to work with what they have, and yeah, I was in the position in the NOS where every place that I worked in, a number of different clinics, there was always a flight of stairs to the first floor, and it
mm,
automatically eliminated so many people from being able to access my services who may have needed it because they just couldn't get up the stairs. There was, you get, what could I, paying for rent in the NOS and working in clinic space, there's not much you can do about that, really. And that's a real shame. Making sure that they could find healthcare, refer them to people that
mm,
had one flight of stairs that didn't go up or down, was essential. But yeah,
mm.
it is. I find telehealth so beneficial for my patients, and I also, as a practitioner, the benefits to me are pretty good as well. I love it. I can
Mm.
play with the cats between appointments and sit in the garden, and my commute to work is, I mean, the only problem with not having a commute is I don't get to listen to podcasts that everyone talks about, because when do I have time to listen to podcasts if I don't have a
Yeah,
commute? But
exactly.
so I think there's huge benefits for patients and
Mm,
practitioners as well. But yeah, it needs to be done properly. But yeah, no, I mean, it's a huge pivot for you guys, and but it would be great for everything in Australia. I love the idea of there being a rough patch in every city. I hope that happens
yeah,
for you,
me
Amber.
too.
Um, well, listen, we could, I get the feeling that we could probably guest bag all day about all these things. So thank you for your time, though. I really, really appreciate it. And yeah, as I said, love these conversations with wonderful health practitioners that do excellent stuff. And I'm a massive fan of Rough Patch. So I'm really glad that you've kept pivoting and kept trying to make it work for people, because my patients get a lot out of it. So thanks, Amber. Great. Thank you, Amber. Thanks for your time. Thanks for listening, everyone. And we'll keep having nice conversations with people and give you more content. See you later. Bye.